All right, thank you so much for joining us. It's still the conversation here on Lagos Television. Sometimes network can, just want to give you some kind of a headache. But again, thank God for technology. I still have Dr. Anyanwu with me here on the telephone, so we will continue this conversation this morning. So very quickly, Doctor, you were taking us through what exactly a stroke is. So quickly, let's end on that.
Sure. So I had said that the brain controls every body function, all the body parts. And the brain needs constant oxygen and constant blood flow to it.
Okay.
And if that supply of oxygen is cut off by whatever means, and there are two basic ways it can be cut off, then that part of the brain does not receive blood and does not receive oxygen, and its function fails.
Mm-hmm.
To further understand it, the brain on its own has different rooms or different parts that perform these functions.
Okay.
So the part that moves the hand up and the one that moves the legs down are not the same. The one that is responsible for you to see and the ones for you to talk or understand are not the same.
Okay.
So there are little compartments of rooms, and once those rooms or those parts of the brain, the supply of oxygen is cut off and blood is cut off, then you have suffered a stroke.
Right.
So stroke, in effect, is an acute neurological condition resulting from the loss of blood supply to a segment of the brain.
Right.
There are basically two ways that can happen, either because the blood clot is blocking blood flow to that part of the brain, what we call ischemic stroke, or because the blood vessel in that part of the brain has burst open, what we call a hemorrhagic or bleeding stroke.
Okay.
When that happens, it causes a stroke,
Right.
which manifests by loss of the body function, whether it's speech, vision, hand or body movement, that is because of the function of that part of the brain being lost because of what I just described.
Right. Okay, so doctor, why then has there been this mindset or mind belief that stroke is often associated with the elderly? So with what you've just explained, it means that this can actually happen to anybody, or age range or age wise. But then, I mean, in years past, we've always known that you could have people maybe from 50 and above come down with stroke. So is that just a myth or a belief that needs to be needs to be dispelled?
Well, it's not really a myth.
Okay.
Even though what we see in Nigeria is a little bit different, and I will explain.
Right.
The reason why it's not a myth is that for you to understand why you have had a stroke, you must understand the things that lead to having a stroke.
Okay.
And some of those things that lead to having a stroke builds up over time. Consider it like you're buying a brand new car. After a while, you have driven it for the first 5 years, it may not give you any problem. But if you continue to drive that car for 5, 10, 15, you start noticing problems, especially if you have not maintained the car. To understand all the risk factors for stroke. So there are two major types of risk factors for stroke. What we call the modifiable risk factors, things you can change, and the non-modifiable risk factors. The modifiable risk factors include things like diabetes, high blood pressure, smoking, hyperlipidemia, obesity. Sometimes people also classify lack of exercise as also modifiable risk factors.
Okay.
So by definition, as you can understand, diabetes tends to also occur as we get older. High blood pressure as we get older. That doesn't mean it doesn't occur in young people.
Okay.
And therefore, it takes years after you've developed these disease conditions for it to lead to the blockage of vessels leading to a stroke.
Okay.
That's why it tends to occur as people get older. Now, the non-modifiable risk factors are things like family history. If you have a family member who have suffered a stroke, you're at a higher risk. You cannot modify that.
Okay.
Age is not modifiable. Again, based on the fact that some of these risk factors tend to occur later in life, you can modify it. If you have a personal history of having had a stroke, you are at a higher risk of having a stroke. So you can modify it.
Okay.
And then there are several other genetic factors which hopefully we are going to touch very briefly in
Right.
this.
Right.
That can also predispose you to stroke. It can modify those things. So
Okay.
in general, it tends to occur in older people because this disease condition has been there for a while.
Right.
But that's not what we see in Nigeria. We see it in older people. We also see it in younger people in Nigeria.
Right.
And there may be several reasons why that happens, including the fact that we don't go to hospitals on time. So sometimes we have some of these problems and it gets untreated. For instance, what was the last time you, the listener that is listening to me, checked your blood pressure? When was the last time you went to the doctor to have a good physical examination? If you have diabetes, would you know that? If you have high blood pressure, would you know that? Even pollution in some of our big cities can be a problem. In developed world, we talk about cigarette smoking, but in our world here in Nigeria, because of the unique circumstances, even air pollution by fumes from vehicles can be a risk factor. In general, stress can also add to this. And then, of course, irrespective of these things, there are certain other unique things that can happen to younger people that can predispose them to a stroke as well.
Okay.
In general.
Let me cut into your thoughts there, Dr. Anyanwu. And then is it possible to put an age bracket to the young adults we're talking about? Because, again, sometimes we're not able to decipher who a young adult is or who an adult is. And so if here we're talking about the increasing rate of strokes or stroke amongst young adults, are we able to put an age bracket into those that we're talking about today?
Oh, absolutely. Let me be clear before I put that age bracket that stroke can occur in anybody. It can even occur in the neonatal period, kids that have just been born.
Okay.
It tends to occur in very young adults, in the adolescents as well, even in Nigeria. And one of the risk factors for that is sickle cell disease. Sickle cell is very common in our environment and can predispose even adolescents to having strokes. However, in general, we have seen that in developed world, it's really people in their 60s to the 80s that tend to have stroke. But in Nigeria, the data suggests people around their 40s to their 50s that tend to have stroke, sometimes even more than people who are much older. Even though those demographics doesn't change, but we are seeing a lot of this in people in their 40s to 50s, sometimes up to 30s to 50s in Nigeria. So I would say that bracket in Nigeria will be probably from 30s to 50s that we're seeing it in the young adults.
Right. So since we've put an age bracket to the people we're talking about this morning, earlier on you did mention that one predominant reasons why people could actually come down with a stroke is lack of hospital visits, because we have not formed the habit of going to the hospitals frequently here, so we can get some of these things arrested before they actually are overboard. So aside that, and then a family history of stroke, what are those other issues that could be factors that young adults or young people also need to start paying due attention to?
Sure. So in addition to not going to the hospital or forming the habit of routine physical examination, we as Nigerians have also a very unique predisposing factor that doesn't get talked about, which is compliance. The average Nigerian, as you know, and I've lost very close relatives from this, even when they are diagnosed appropriately with those conditions, are non-compliant. The next thing you start hearing, because of our religious beliefs and traditional beliefs, is that it's not my portion. So a lot of us believe, for instance, that if you are diagnosed with high blood pressure, you take the medication for a while, the blood pressure comes down, you stop taking the medication.
Right.
Either because of religious family beliefs or whatever, social pressure, or sometimes even finance to buy the medication. So now you're predisposing yourself to more problems. Even people who get diagnosed with things like hyperlipidemia, high cholesterol, they start the medication for a while and they stop it. These disease conditions, including diabetes, high blood pressure, high cholesterol, when you have it, often require lifetime measures to be able to control them. unless that you also do what we call lifestyle measures that kind of put them at bay. That's so if you're diagnosed with them, you need to keep visiting the doctors.
Right.
But there are some unique things, like I said. So in women, for instance, who are on oral contraceptive pills, the chances of having a stroke is also high. So you need to watch that. I'm not saying you shouldn't be on it, but there are people predisposed to that.
Okay.
There's a lot of craze amongst our generation and amongst the younger generation of weightlifting, and in doing that, they may take a lot of steroids. Those things put you at risk of strokes.
Okay.
There's also some unique things that disease conditions that we have amongst ourselves. People who have what we call hypercoagulability states. Their blood tends to clot more than the regular people. These things can be figured out by your doctors or based on some of your histories, the hypercoagulable states. An example is when women continuously lose pregnancies. They have some sort of abortions, not necessarily pregnancy loss, that we can trace a condition we call factor antiphospholipid antibody state. In general, it's important that you see people who are specialized in stroke treatment who can investigate you and also look at these risk factors. Or form a habit to say, I need to go for a test to look at if I have risk factors for strokes, and then if you have that, to address that, just like we do when we go for tests to look for risk factors for heart problems or any other part of our body.
Are these things, are they preventable? So again, I know that in medicine, there's always this balance of early detection. So what are some of those things that we need to start taking cognizance of early enough to avoid suffering a stroke?
So definitely that is preventable. If you remember, I had said something about modifiable risk factors.
Sure.
So the modifiable risk factors means it can be modified. It can be prevented. High blood pressure can easily be prevented if you're not obese. And even if you have it, you can control it very well. Therefore, significantly reducing the risk of stroke or heart disease. Diabetes is the same family. High cholesterol, smoking, exposure to toxic fumes, even the use of, has been documented, even the use of what we traditionally use to cook firewood continuous exposure, not just a one-time exposure. Continuous lifetime exposure can be a problem. So these things can be done. Regular exercise can help you to reduce this risk. So there's a lot of things we can do to reduce the risk of stroke. And then there's some that you really can't change. Whether you're female, you can't change if you've had a stroke before, there's a family history. You can't change those things, but you can significantly reduce that risk as well.
Right. Let's quickly talk about management, because again, sometimes people get worried that if you've suffered a stroke, there are likelihoods that you might not be able to use your hands or your legs again, or a part of your body. And then others will say, if you get affected by the left side, it's usually worse, or if it's on the right side. So take us through this. If you suffer a stroke, is this something that you can come out from, talking about the management now of a stroke, and then here, just in case you suffer it, is this something that you can heal completely from?
Oh, definitely. Now, if you know my background, you know that I actually trained in the United States, and I was medical director of one of the largest U.S. hospitals that treats strokes. I'm actually a stroke specialist. One of the reasons I decided to return to Nigeria was to see how I can impact, together with my colleagues in Nigeria, to make a difference. And therefore, we have a stroke center here, which you just talked about, the Region Stroke Center. And so the reason behind that, again, like I said, is how can we make this difference? You have to understand that stroke is the #1 cause of disability worldwide. And like we have already established, things to affect younger people in Nigeria. These are people who are the breadwinners. These are the bank managers. These are the teachers. These are the professors that it affects. And therefore we have to do something about it, because it also has significant economic issues with our economy when these people suffer strokes.
Okay.
So there are ways to treat this. So number one, there is what we call the acute period. If you do have a stroke, it's important for you, just like if you have a heart attack, to see a heart doctor. It is important for you to see a doctor specialized in the management of stroke, or ask for that. You are usually neurologists. In that acute period, if it is a blood clot that has caused it, we have been using in the United States since 1995 a clot buster that dissolves that blood clot like magic, what we call TPA, tissue plasminogen. It dissolves it. You can get that drug in a specialized center within the first 4.5 hours and sometimes up to 9 hours. It's an injection that's given. Yes, it's expensive, but when you compare that with being on a wheelchair lifelong, it's better for you to do that rather than for you to ignore it.
Right.
If it goes in, it dissolves that blood clot I just discussed. Blood flows back to that part of the brain, and in a lot of cases, the next day you walk out of the hospital.
Okay.
Now, if you're unable to do that as well, there are also things that you can do. There are specialized centers, and there are a few in Lagos, that you can go in and do a procedure and drag that blood clot out.
Okay.
So I offer this service with some of my colleagues in the United States through telemedicine, just like we're talking. That they can do thrombectomy here, yes, in Lagos, even in Lagos and across the country. Once you restore blood flow to that part of the brain, the person can potentially get better often dramatically, and walk away.
Okay.
Expensive stuff because there are not a whole lot of places where they do this, but it's important for you to know this, so that when you get to that hospital, wherever you go, you tell them, do you have this blood clot dissolving medication or blood clot medicine?
Okay.
If you're unable to get that, yes, there are specialized rehabilitations, what we call specifically here neuro rehabilitation, that can help you walk again.
Right.
That's usually physical therapy. That can help you be able to use your hand, dress yourself, feed yourself, cook, occupational therapy. And that can also help you to be able to speak again. That is speech therapy.
Right.
These services are valuable, yes, not in a lot of places across Nigeria, but in a lot of the big cities, especially Lagos, Owerri, and a few other places, they are available. And that's what we do even here, to restore people who have suffered a stroke. Sometimes people have suffered a stroke and come to us 5 years ago, and we're able to restore them in a way that they're able to at least function in a family unit and take care of themselves. They may not be 100% back to normal, but we're able to do that.
To help them.
And it's a combination of that physical therapy, occupational therapy, and speech therapy, directed by somebody who is a specialist.
Right. We'll have to leave this conversation here this morning. I'm glad that at least you've told us that suffering a stroke is not really a death sentence. It's not cheap, but it is something that if you can afford, at least it's way better, than suffering lifelong disability. Thank you so much, Dr. Bernard Anyanwu, Professor of Clinical Medicine and Neurology, as well as the EMD Regions Healthcare. Thank you for giving us your time and expertise on the program this morning.
Thank you for having me.
Right.
October 29 is the World Stroke Day.
Okay.
Please join us in celebrating that across the world and in Nigeria.
We will definitely remember that. Enjoy the rest of your day, Dr. Anyanwu. Thank you.
You too. Bye-bye.
All right, we've been speaking with our guest this morning, and he's taking us through what exactly a stroke is, and of course, why there is the increasing cases of stroke in young adults, and what also we should be doing to ensure that we do not suffer a stroke. We'll take a quick break. The conversation returns shortly.